We're trying to bring you as up-to-date information as we can, and we do that with the cooperation of many in this community that help us out, and they have very busy schedules, but they also believe it's important to get information out, and one of those is Dr. Mark Wakefield, and he's Associate Chief Medical Officer at MU Healthcare. He joins us now. Doctor, good morning. I hope you're doing well today.
Good morning, David. I'm feeling well, thank you. A little tired, but got a good night's sleep and doing well.
Good night's sleep would mean how many hours? 5, maybe 4, 5?
I think I got 6.
Wow.
Working on resilience and self-care, isolating myself and trying to be in best physical condition as possible.
Let's talk about right off the bat what is new as far as the last couple of days in regard to visiting policies and testing policies that will be at MU Healthcare. Okay.
I think the most important message is that we have demonstrated community spread of COVID-19, which escalated MU Healthcare to our third level of a response, which is designed to protect patients, staff, employees, and the public to decrease risk of transmission. So that results in a restricted visitor policy, visitors only allowed in select circumstances, which we'll learn from and adapt, but are designed to protect all involved. Elimination of elective but necessary treatments that can be deferred, and triaging our clinics and hospital care.
What's the best way for somebody who has a question about, well, is my medical procedure one that I should continue on with or not? I guess, what do they do? Contact their doctor's offices?
That's correct, and that should be a discussion of the risk and benefits of proceeding with that procedure. Is there a greater risk of deferring that procedure? I'm thinking cases where there might be surgery for cancer, or and every cancer and every patient is a little different on their risk and vulnerability and the aggressiveness of the disease state. So maybe deferring for 6 weeks is appropriate, but maybe it's not, and the benefit of proceeding with surgery is greater than the risk. And really the person who knows that best is the provider and the patient together in a shared decision-making model.
I think it's always one of those where when we're starting to become, I guess, acclimated to a new vocabulary, I always want to err on this side of overemphasizing or maybe over-explanation, which would be the right way to do it. You mentioned community transmission. Would you please explain why that is one of the noticeable things that those in the healthcare professions take note of in regard to this pandemic?
Correct. So the initial cases are usually acquired by travel. So someone went to a place where the illness was present and they brought it back to their community, usually asymptomatic at the time of travel, and then shed virus when they get the symptoms. And then once there's community transmission, the concern from care providers is that the rate of increase in number of cases becomes exponential because the spread gets passed quickly from multiple contacts. And that's why, although there were no cases, people were starting to socially isolate because there were potentially people who were asymptomatic at the time. So the concern and why we increased our level of care is we have to be on the ready with preserved resources and available staff to take care of the anticipated increased number of patients who will need care.
And when was the community transmission detected?
So I think we had strong evidence yesterday that there was community transmission based on the number of cases, and the patients who were identified with having a positive test did not personally have travel histories. So in our predictive models suggested that when the community got to 5 cases that were not travel related, then we had documented evidence of community spread.
So are there patients at MU Healthcare now who have tested positive for COVID-19?
So we've had definitely patients who've tested positive in our ambulatory drive-through setting. My understanding is that we have 1 patient in the hospital who is COVID positive.
So help me understand, if someone is tested positive, that does not mean they automatically are a patient at a hospital or put into a hospital. Would that be true?
That is a great point, and that is absolutely true. The vast majority of patients who have COVID are taken care of at home, and the vast majority, 99%, appears to recover. So the person in the hospital is someone who, is short of breath or having difficulty breathing or is otherwise vulnerable and needs other medical care. But the vast majority of patients should go home under the instructions of their providers, do good self-care, social isolation, limit their care provider at home to one person, wash hands frequently, stay hydrated. Like many of us get through other illnesses this time of the year, but with more discipline for hand washing and self-isolation.
What is being advised as far as kind of to make tolerating the discomfort and the problems associated with this, and again, this is for non-hospitalized persons who have tested positive, is aspirin, is Aleve, is Advil, what's suggested to help tolerate it better?
So if you don't have a reason not to take Tylenol, and that would be usually if you don't have liver disease, then Tylenol is safe. That is the preferred treatment for fever and discomfort. There is uncertain, that things are happening so fast. The science is communicated with rapidly, but without the traditional careful review. There is some concern that nonsteroidals like ibuprofen or naproxen might be associated with a worse outcome. But we have no definitive knowledge that those are causative associations. So, my recommendation as not an expert in the medical management of COVID is to avoid those medications if reasonable. Just a little bit of abundance of caution.
I know you're in demand. Let me ask one final question. Address, please, the increased number of people that can be tested. What do we need to know about that through MU Healthcare?
Well, we've been successful in deploying drive-through testing, but we have to potentially shift our mind to what are the benefits of testing. So we may get guidance in the future that if you're otherwise healthy, young, and minimally symptomatic, but possibly have COVID-19, then it may not be necessary to be tested. Our capacity is good right now. They're doing several hundred tests per day, but we have to be mindful, like all aspects of our care, of limited resources, personnel, supplies, testing capability, and reserve it at some point for the people who are most sick.
So again, maybe the advice would be to check with your personal physician and let that physician, her or him, tell you whether you should go testing or not.
Absolutely. Great advice.
Dr. Wakefield, thank you so much. This has been a good segment. I don't know whether we'll have an opportunity to talk again, but if we do, we'll look forward to new updates from you. Best of luck. Thank you, sir.
Okay, thank you. Bye-bye.
Bye. Dr. Mark Wakefield, Associate Chief Medical Officer at MU Healthcare, with some really good information for us today. This is KFRU.